I'm Shawn Valenta. I'm the Administrator of Telehealth here at the Medical University of South Carolina. In South Carolina, it's a small state. It's a very rural state. There's been healthcare disparities for a long, long time in, rural, often, minority populations, vulnerable populations that don't have access to care. Telehealth is, one tool, one potential solution that actually has achieved bringing more care, more access to care, and improving patients' quality of life in a lot of those different settings. MUSC Center for Telehealth, it was founded in 2013. MUSC is a state entity, but we're also, had a lot of expertise in telehealth at that time. They wanted to do a couple things. They wanted MUSC to create telehealth services that address the needs of different communities across our state, and they also wanted us to create a statewide collaborative where other organizations can all work together. The result of that was, one, the founding of the MUSC Center for Telehealth, which has now grown into the creation of 80, 90 plus telehealth services being developed and many more in the making. And also the South Carolina Telehealth Alliance, which is a statewide collaborative tied together by annual strategic planning and contractual relationships. So we work with a lot of the different health systems to transform the way care is delivered in our state in an intentional way. So we're all making sure we're rowing in the same direction. Internally, we started to go about this rapid, what I would say, enterprise adoption of telehealth services. So really, taking, all of our clinical services inside our walls, we should be able to deliver those services outside our walls. Most of the people that have had experience in telehealth, they've got good depth in maybe one or two services and have gained notoriety with those. We have that here at MUSC with some of our big programs, telestroke, school-based telehealth, diabetes, tele-ICU. But one of the other things we're known for is our depth across the spectrum. And to be able to do that, we had to create processes and a framework to be able to rapidly develop telehealth services in an efficient, effective way, which is how the creation of what we call TSIM, the Telehealth Service Implementation Model, was created. For us, it was created out of necessity because we were having so many growing pains of how do we do this at a full scale? So we really started to develop services in a meaningful way, and that's continued to mature over the last so many years. One resulting in MUSC becoming a national telehealth center of excellence. I had a good friend in high school that got in a bad car accident. So that was kind of one of my first introduction, I would say, in some type of healthcare. I started working at Greenville Memorial as a respiratory therapist, worked a lot in the emergency department, and I would have a lot of physicians that worked in the ED that would start taking me under their wings and teaching me a lot of different things about healthcare that had nothing to do with respiratory. They could just see, I think I had an appetite for learning, and I wanted to soak up as much knowledge as possible. When I came here, I started working in the respiratory department at MUSC. I was working night shift. I started working on a project to help create the first MUSC ventilator weaning protocol to get patients off a ventilator for the health system. And I was working nights. So one of the things, I would have to come to all the different meetings that were happening at noon. So I would either work all night and stay up and come to a 12 o'clock meeting, or I'd sleep in my car for a while and come back. And I wasn't even in a leadership position at this time. I was a staff therapist, but I just wanted to get this accomplished. And something I thought should happen in 3 months took almost a year grinding to get everyone's acceptance to get this passed. But when it got it passed, I guess shifted in my mind this look towards health administration. If I stay clinical, I'm gonna be a good clinician. I said, but if I shift in towards health administration, I'm gonna have the ability to affect large populations. And that was always something I was passionate about. How do I affect large scale change? And then that's when I went to the MHA through MUSC. I think a good leader is someone that can effectively communicate their vision and a clear strategy, but also have the ability to get buy-in and engagement from that team to go on that journey with them. I tell our team often, the one thing I can predict in healthcare, it's going to continue to change, and we cannot fully predict that. We can't stop it. The one thing that we can do is develop a team that is so efficient and nimble and ready to shift and trust each other and work together. So regardless of what that change is, we're able to bring, solutions forward in a meaningful way. I used to always think innovation was somebody who thought of some big idea that nobody else could think of. And that is, I guess, one form of innovation. I'm more been like a process improvement type of person. And that's where I feel like the center has done a lot in regards with our innovative work. It hasn't necessarily been on maybe a new technology, but it's oftentimes the way we deploy an existing technology and the innovative ways that we deploy it and redesign the way that care has been delivered in the past. We can't redesign every clinical service, but what we can do is show use case examples and open up that door for these physicians who really do know their clinical practice. And once that door is open, potential is endless. Our mission statement at MUSC Center for Telehealth is telehealth for efficient, effective care. And that's something that I've tried to ingrain in our team. It necessarily didn't come from me. It came from our executive medical director, Dr. Jimmy McElligott. But he always used to say to me, a lot of old school people in telehealth have been doing this for 20 years, talk at conferences saying, telehealth's all about replicating care over distance. He really ingrained in me that if we just replicate a current broken system with all these innovative new technologies, then we're completely failing at what we're doing. As we started growing our team over the next couple of years, you start getting bigger, you start getting more distance away from frontline activities. And I realized that we were starting to create telehealth services that replicate care over distance. And so at that time, we intentionally changed our mission statement to telehealth for efficient, effective care. To be able to push innovation, you have to have a systematic way of doing it, at least at the scale of what we're trying to do with so many stakeholders. I think it's different if you got a small team trying to be innovative together, but in telehealth, by definition, it takes two to tango. Like you have to have these other partners and you have to have trust within these different relationships. But you also have to have a clear vision, be very goal-oriented and to make sure everyone's, trying to achieve this same thing. So, we've kind of always continuously looked at that as, a continuous process improvement and how we can make different points of development within that process. But one of the things that we've been fortunate enough in South Carolina, having the investments from the state, is the state has actually charged us with saying, hey, be innovative in this space, push the envelope. We want to be leaders here. We believe in this for our citizens. We realize we have areas that we need to address in regards to healthcare access and quality and cost, and we believe telehealth can do that. So we definitely have that charge from the state and the federal government of being able to think about telehealth delivery in new innovative ways. There's a lot of different startups in the telehealth world. The investments in telehealth and digital health have been growing drastically over the last 3, 4, 5 years. But often what I find is these new innovative thinkers, they don't really understand the industry and market that they're trying to disrupt. And I think there's been some good ideas that have potentially come through that might have been even too early for their time. They might have thought of some new and efficient way to deliver care, but the current reimbursement system didn't support that. Unless they have enough time to be able to develop that and tell that story to funders or payers in some way, they're gonna go out of business quick. So, understanding the industry that you're trying to disrupt, to be able to speak that language and know where you can come in and bring value at that time. So, the market might not be there right now, but what is our pathway to make sure that it can be sustainable in a couple of years? If I were to speak to other innovators, I would say don't accept what's acceptable. To be able to push forward and kind of thinking of like how could we do this better? And some of the pain points that people experience, people just accept that. It's like, well, that's just the way it is. But it doesn't always have to be that way. And I think that opens up the doors towards just really thinking about like how things can be redesigned. My name is Shawn Valenta, and those are my notes on innovation.